Honey, I'm in a lot of pain still. This has been occurring for a while, and I can't control my bladder, and it is very painful to urinate. I don't understand why this is happening to me. I think I need to see a doctor.
Hello, Mark.
Dr. Wright.
Nice to meet you. How are you feeling?
Well, not too good lately. I've had trouble with my bladder control, and there's been blood in my urine, so I haven't been really feeling myself lately.
Okay, well, we're going to try to figure out what's happening. I'm going to start with some questions. So you're having trouble urinating and it's painful.
Yes.
Okay, how about any blood in your urine? Alright. Pain in the lower back, pelvis, hips, thighs, anything like that?
Yes, actually, there has been some of that.
Okay. Sometimes that just happens, soreness with age, but you could just look at your other symptoms to make sure. Do you have frequent urination, especially during night?
Yes, it has been keeping me up at night, actually.
Okay. How about difficulty in having an erection or little fluid ejaculated?
Yes.
Alright, well that's all the questions I have for now. Okay, so based off of the answers you gave me, there's a few things that come to mind. The first is benign prostatic hyperplasia, which is just enlargement of the prostate gland. And hematuria is blood in the urine, which could be what's causing that. Hydronephrosis is the swelling of the kidneys, which is due to insufficient urine drainage or erectile dysfunction. But the worst case scenario, I'm afraid, is prostate cancer. So we're going to have to do a couple more tests and a prostate-specific antigen blood test to see how those results will come out, and then we'll move from there.
Okay. Sounds like a plan.
Alright, Mark, I have the results here from your blood test. And as you can see, I'm afraid that your PSA levels are high. So, not really a good sign, but I want to do further tests just to make sure. So I'm going to send your information to Fort Loudoun Medical Center for further testing.
Okay. Thank you, Dr. Wright.
Let me know if there's anything else I can do.
Thank you.
Mark? Hi, I'm
Hi.
Dr. O'Brien. Nice to meet you.
Dr. O'Brien.
Alright, so I see here that Dr. Wright did some PSA tests on you and that your levels were kind of high. So she sent me over the results, and based off of that, I'm going to do a couple more exams to check out everything that's going on. And I'm going to start with the digital rectum exam. So we're going to have to take you back into a room and start that, if that's okay.
Okay. Sounds good.
Alright, well, I'll meet you back there in a couple minutes. The nurse will come and get you.
Okay. Thank you.
You're welcome. Hi, Mark. So, after we did the DRE, we went ahead and, we also did the ultrasound just to see what that lump was, because we believed after the DRE that we felt something that could be a tumor, so we went ahead and checked it out. So I have here your results. You can look at them. So these numbers are kind of high here, and those were your blood levels. So we went ahead and did the ultrasound, and right in this area is where the prostate bump is. It's kind of hard to see, but so that's yours. But we also pulled up an MRI of one, and that kind of shows you the enlargement of it. This is another patient's, but it's very similar to your case. So, it looks like we are dealing with prostate cancer. I'm so sorry, Mark. Okay, so the next thing I will be doing is sending your results to the pathologist. And she will be getting those very soon, and I'll get on the phone with her and discuss it with her. And if she confirms that, I'll be sending you to an oncologist. And they'll just be able to further evaluate the situation and come up with a plan to go from there. I pass everything on to them. The last thing I'll do is take a biopsy of prostate and your bones, just to get an idea of how severe this case is. And then Dr. Jones, the pathologist that we will be talking to, will send me the full results just so I can know, but I'll go ahead and set up an appointment for you with the oncologist once I get the results from Dr. Jones. That's our plan. I'll get in touch with you soon, and you let us know if you need anything else. Do you have any questions?
Yeah, I don't think I can afford any of this because I don't have insurance.
Okay, I did see that on your chart. The doctor I'm sending you to does work with uninsured patients and gives discounts. You may want to ask your family members if they can help because you will have to pay. But Dr. Smith is a great oncologist and I trust that she will do her best. But I am sending you to Dr. Smith, who I trust a lot and is a great oncologist, and I'm very trusting that she will give you a great discount and work with you to make sure that we can keep you as healthy as we can.
Okay.
All right. I'll talk to you soon.
Thank you, Dr. O'Brien.
You're welcome. Hello, this is Dr. O'Brien.
Hello, Dr. O'Brien. I'm calling with the results from your patient Mark's biopsy. Unfortunately, you were correct to believe that Mark has prostate cancer. Your patient has stage 4 prostate cancer, meaning that the tumor has spread outside of the prostate. The cancer is also metastasized into the bones. Generally, there's no cure to prostate cancer that's developed. I think that the best way to handle this is hormone therapy, which should at least give him some more time. I will let the oncologist know. You need to prepare Mark for the future to come and encourage him to get in touch with a grief counselor.
I was afraid of this news. I will let Mark know and we'll send him to see Dr. Smith. Thank you, Dr. Jones.
Hello, Mark. I see that Dr. Bryan has referred you to me. I got your full report right here from Dr. Jones today, and I have some news that could be hard for you to hear. You have stage 4 prostate cancer. This means that the tumor has spread outside of the prostate and has also metastasized in your bones. Since the cancer is not contained in the prostate, many treatment options are automatically ruled out, but I believe that your best option would be hormone therapy. How much more time do I have? I think the first thing we need to start with is androgen deprivation therapy, or ADT, which is hormone therapy. It'll give you more time than you would have because it reduces the number of androgens in your body, which is what stimulates the cancer cells to grow. And by lowering these levels, it'll hopefully help the cancer to stop spreading as fast as it currently is and shrink it. But I also think that you need to get in touch with a grief counselor to help with what is coming due to the advanced stage of your cancer. I estimate less than a year. I'm sorry, Mark. Okay, I'm willing to do anything to give me any more time. Alright, the last thing we need to discuss is how to pay for your treatments. You'll be required to prepay an estimated cost since you don't have insurance. I'll give you a discount since you don't have insurance, but do you have a way to pay at all? Well, I've asked my sister to help cover the costs. That's great. Then we'll begin therapy next week. Wait, Kamila, get out here.
It's my fault.
Wait, okay.
Margaret!
Okay, go.
Is that sticking on you?
Honey, I'm in a lot of pain still. This has been occurring for a while.
Hi, nice to meet you, Mark.
Nice to meet you, Dr.
How are you feeling?
Well, let's see it. What? I don't know what my line is.
Margaret!
Nice to meet you.
How are you feeling?
Not too good lately. I'm having trouble with my... I can't look you in the face. Water control.
Yeah, which is harmless enlargement of the prostate gland, and hydrophrenesis. What's that? Let me read this right.
Oh, I'm filming now.
Bless you.
Bless you. There are a few things that come to mind that you're.
Bless you!
Bless you. I need to explain that. Tell me.
Hi, Mark.
Hey, Dr. O'Brien.
Do her best to help you both in the medical field, and that didn't make any sense.
Is the sound on?
The tumor has spread outside of the prostate, and that has also metastasized into your bones.
Okay, ready?
Close the door.
I want to see you die.
You can see in the video.
Okay, ready? Eyes open. 2 deep breaths.